Pain is big business. $20 for a bottle, $2,000 for a prescription, and still the number one side effect is dependency. Each year, over 16,000 Americans bleed to death internally from so-called everyday non-steroidal anti-inflammatory drugs like ibuprofen. The entire supply can vanish with a single trucking glitch. But there is a weed stronger than ibuprofen hidden in every lawn, unpatentable, unowned, and centuries older than the pill bottle. Why does pharma want you to miss the painkiller literally growing at your feet? Unlocking it means you are no longer a customer. You are your own field medic. But first, the cost of trusting the system. Every bottle of ibuprofen comes stamped with a promise: fast relief, no questions asked. But behind the pharmacy shelf, the numbers tell a different story. Each year, more than 16,000 Americans bleed to death from the inside out. These are casualties of so-called safe painkillers. These are not rare freak events. They are routine, predictable outcomes of chronic non-steroidal anti-inflammatory drug use. The medicine cabinet has become a quiet battlefield. Stomach ulcers aren't a distant risk. For anyone taking ibuprofen daily, the odds are as high as 1 in 5. Endoscopic studies show that 10 to 20% of chronic users develop ulcers within just 3 months. Most will not feel a thing until the damage is done. Internal bleeding can start with a single microscopic tear, invisible and painless, until the vomiting, until the black stools, until the ambulance ride. Silent. The body count rivals traffic deaths and outpaces fatalities from some cancers. Hospital records log more than 100,000 admissions each year for emergencies related to non-steroidal anti-inflammatory drugs and the gastrointestinal system. The cost? Billions in medical bills, lost wages, and lives cut short. Yet the labels still say non-steroidal, as if that means harmless. The real risk is not addiction. It is the slow, silent breakdown of the body's defenses. Non-steroidal anti-inflammatory drugs strip away the stomach's protective lining, leaving raw tissue exposed to acid. The result? Ulcers, perforations, and catastrophic bleeds. Age, high doses, mixing with alcohol or blood thinners, each factor multiplies the danger. For the elderly, for those with a history of ulcers, the risk climbs even higher. Pain relief has become a calculated gamble. The odds are stacked against anyone who trusts the system to keep them safe. The numbers do not lie. The casualties are real, and the price of convenience is paid in blood. Painkillers only work if you can get them. The entire non-steroidal anti-inflammatory drug supply chain runs on a knife's edge. It is fragile. Every bottle of ibuprofen depends on a global relay of chemical plants, shipping containers, and trucks. Nearly all the active ingredients are synthesized overseas. China and India hold the keys to most of the world's generic pain relief. From there, the raw materials cross oceans, funnel through a handful of US factories, and then hit the highway. Over 80% of pharmaceutical freight in the United States moves by truck. A single bottleneck, whether a strike, a cyber attack, or a fuel shortage, can freeze the flow. In 2024, more than 200 drug shortages were reported, many tied to a single supplier or a delayed shipment. When Hurricane Maria slammed Puerto Rico, ibuprofen vanished from shelves in dozens of states for months. 3 companies, McKesson, Cencora, and Cardinal Health, control 90% of drug distribution in America. Pharmacies keep only a few days' supply on hand. If a major distributor's hub goes down, the pain aisle empties in less than a week. This is not just bad luck, it is by design. The pharmaceutical market is engineered for maximum profit, not resilience. The goal is to move product just in time, lock the consumer into repeat purchases, and keep inventory costs low. The result is a system that works perfectly right up until it does not. When the trucks stop, the pain starts. The convenience of the pharmacy is a mirage, fragile, expensive, and completely dependent on forces far beyond your control. For the average person, that means a headache is never more than a supply chain hiccup away from becoming a crisis. The real vulnerability is not in the body. It is in the system built to keep you numb. If the network fails, the only painkiller left is the one you can make yourself. Vicksburg, 1863. Union ironclads choke off the river, and the city is strangled from all sides. Inside the Confederate lines, the field hospitals run dry. The supply wagons meant to bring morphine and chloroform never arrive. Surgeons ration the last drops for amputations and the worst wounds. For everyone else, pain becomes a second enemy. Soldiers with shattered limbs are packed shoulder to shoulder, waiting for relief that is not coming. Official records from the siege describe morphine barrels running empty and surgeons forced to improvise with whatever the land can provide. Alcohol, willow bark, poppy seeds, anything to dull the agony. In these moments, the boundaries between doctor and scavenger blur. Medicinal gardens sprout behind the lines, stocked with whatever wild plants can be found. The National Museum of Civil War Medicine preserves kits from this era, filled with crude tools and faded labels: dogwood, blackberry root, wild lettuce. King's American Dispensatory, the period's medical Bible, lists Lactucarium, dried juice of wild lettuce, as a mild sedative, a fallback when opium is gone. Field letters refer to substitutes when morphine failed, and regimental logs record a constant search for local remedies. It was not heroism, it was necessity. When the blockades closed, innovation followed. The pain did not wait for the next shipment. It pushed surgeons and soldiers into the fields, hunting for relief in the weeds and hedgerows. Every dose scavenged was a small victory against the siege. Where the pharmacy failed, the wild took over. In the years after the Civil War, wild lettuce stepped out of the hedgerows and into the official books of medicine. The 1890s saw American pharmacies advertising lettuce opium as a household remedy, a sedative for pain, coughs, and restless nights. One advertisement promised safer than opium, quiets coughs for pennies, positioning wild lettuce as the affordable answer to morphine's risks. It wasn't just a folk cure traded in whispers. The reference texts of the day gave it a formal place. King's American Dispensatory, the period's gold standard for materia medica, lists Lactucarium, the dried milky juice of wild lettuce, as a mild sedative recommended where opiates are not available. The language is clinical and the intent is clear. This wasn't quackery. It was a sanctioned fallback, recognized by physicians and pharmacists when the usual drugs ran out or proved too dangerous. The United States Pharmacopoeia included Lactucarium in its 1898 edition, cementing its status as an accepted ingredient in lozenges and syrups. Dispensatory pages describe its effects as calming, its safety profile as preferable to opium, and its cost as accessible to working families. In the late 1890s, wild lettuce became the painkiller for the everyman, documented, dispensed, and trusted by those who built the backbone of American medicine. These printed records stand as proof. The wild weed was not just a last resort, it was a legitimate tool in the medical arsenal, endorsed by the very authorities who wrote the rules. Inside every stalk of wild lettuce, a chemical arsenal waits. The milky sap, Lactucarium, does not just look potent, it is. Pharmacologists have isolated two key molecules, lactucin and lactucopicrin. Both are sesquiterpene lactones, bitter to the taste, and both act directly on the central nervous system. In controlled studies, these compounds have shown measurable pain relief in animal models. When mice were given doses of 15 to 30 milligrams per kilogram, their responses matched those from 30 milligrams per kilogram of ibuprofen. That is not a folktale. That is a dose-response curve you can plot on a lab chart. Lactucin and lactucopicrin do not work like non-steroidal anti-inflammatory drugs. Instead of blocking inflammation by shutting down enzymes in the gut, they modulate neural pathways, producing sedation, pain gating, and calm. The effect is real, quantifiable, and does not come with the ulcer risk that haunts synthetic painkillers. Importantly, these compounds are chemically distinct from opiates. They will not show up on a drug test, and they do not trigger the same addiction pathways. The numbers are clear. A single gram of dried Lactucarium can contain enough active compound to rival a standard over-the-counter painkiller. But wild lettuce is not uniform. Potency varies by soil, weather, and age of the plant. That is why the only real test is extraction and measurement. In the world of pain relief, this weed stands its ground, not as a placebo, but as a legitimate chemical contender. In the lab, the truth of wild lettuce is written in peaks and numbers. A vial of dried latex enters the gas chromatograph. Seconds later, a digital signature appears, 2 sharp spikes on the screen, each one a fingerprint. The first peak, mass-to-charge ratio 278, belongs to lactucin. The second peak, mass-to-charge ratio 326, is lactucapicrin. These are not folk tales or herbalist guesses. They are measurable, repeatable chemical facts. Each batch tells a different story. Soil, weather, and harvest time all leave their mark, but the core compounds remain. Researchers have mapped the pathway. Lactucin and lactucopicrin act on the central nervous system, producing sedation and pain relief through non-opioid channels. Unlike ibuprofen, which blocks enzymes in the gut, these molecules work upstream, modulating neural signals. The mechanism is not fully mapped, but the evidence is visible in every chromatogram. No opiates, no morphine, nothing that will trip a drug test. The structure is unique, sesquiterpene lactones, not alkaloids. That distinction matters for anyone worried about legal risk or addiction. What you see on the screen is what you get in the resin, pure plant-based chemistry. But there are limits. Potency varies, and no 2 wild lettuce plants are identical. The lab confirms presence, not uniform effect. This is not a pharmaceutical with a fixed dose, it's a raw extract subject to nature's variability. The proof is there, hard, digital, undeniable. The outcome, however, depends on the plant, the process, and the person. No 2 weeds in the yard are created equal. Wild lettuce stands apart, and the difference is not cosmetic, it is chemical. First rule: never trust a lookalike. Prickly lettuce, sow thistle, dandelion, they all crowd the same ground, but only one passes the test that matters. Wild lettuce grows tall, often reaching 3 to 6 feet by midsummer, with leaves that bite back. The edge is jagged, almost torn, but that is not enough. The real proof runs down the center. Flip a leaf over and run your thumb along the midrib. If you feel a row of stiff, pale spines, like a zipper of tiny needles, you are in the right fight. No spines, no dice. Dandelion leaves are smooth as paper. Sow thistle might fool the eye, but its spines are weak and scattered, never forming that armored ridge. The second test is the milk. Snap the stem or score it with a knife. Thick, white latex should bleed out immediately. This is the lifeblood of the plant, the raw material for Lactucarium. If the sap runs clear or barely oozes, walk away. Timing matters. The milky phase peaks in late morning, when the sun draws the latex up from the roots. Every misidentified plant is a risk. At best, wasted effort. At worst, a trip to the ER. Poison control centers log calls every year from foragers who guessed wrong. The spine check is your safety gate. If it does not bleed white and bristle with spines, it is not wild lettuce. Never skip this step. The pharmacy of the field demands precision, not hope. A single stem sliced open gives up its secret slowly. The white latex oozes out, sticky and bitter, clinging to the blade. This is not salad dressing. It is concentrated chemistry. As the latex is scraped and pooled, the yield tells a hard truth about the work involved. Most wild lettuce stalks deliver between 1/10 and 1/2 of a gram of raw resin. 20 stems might fill a teaspoon, but that is enough to matter. Each drop is a distillation of weeks of sun and soil, now reduced to a dark, tar-like mass. The reduction takes patience. Low heat, never a rolling boil. Too much heat, and the active compounds break down. Too little heat, and the water never leaves. When done right, the latex thickens, darkens, and finally collapses into a dense black resin. This is the legendary black tar, ugly, acrid, but potent. It is not a product for the careless. The dose is measured in pinheads, not spoonfuls. Start with a fragment, 1/10 of a gram, no more. Respect the chemistry. This is not a garnish. It is a tool for pain, and the margin for error is real. The jar is small, but the power inside is not. The final yield is the difference between a forager and a pharmacist, between dependence and sovereignty. This is the checklist for biological sovereignty. First, storage. The black resin belongs in a glass jar with a tight seal, no plastic, no sunlight. Label the lid with the date and the yield. Potency fades if you leave it open to the air. If you want shelf-stable medicine, treat it like ammunition, dry, dark, and accounted for. Record every batch in a notebook where you harvested, how many stems, and the color and texture of the resin. Patterns matter. Some years the yield is rich and sticky, others thin and pale. Over time, your notes become a personal pharmacopoeia. The cost comparison is blunt. A bottle of ibuprofen runs $20 and lasts a month if you are lucky. The wild lettuce resin in your jar costs $0 and 2 hours of labor. No repeat charges, no pharmacy lines, no risk of running out when the trucks stop rolling. Contraindications are non-negotiable. Skip this if you are pregnant, under 18, or taking sedatives. Start with a pinhead. 0.1 gram is plenty. If you feel dizzy, nauseous, or overly sedated, stop. This is potent chemistry, not a salad garnish. A field medic once said, "When the morphine ran out, we turned to what the land gave us. Wild lettuce was not pretty, but it got men through the night." Today, the principle holds. You are no longer just a customer. You are the producer, the record keeper, and the last line of defense against pain. Today, most Americans reach for pills, never realizing potent pain relief grows between the cracks in their driveway. As drug shortages and soaring medical costs become the new normal, biological sovereignty is no longer theory. It is necessity. The lawnweed with white blood isn't just a relic. It is a living challenge to dependency. Pain is universal. The source of relief doesn't have to be. Share your thoughts below.